Hi, I am Dr. Y, and today we'll be talking about the topic fever. Fever. You may need to take down some information during this course of this discussion, and I'm very sure those information will be important to you. In short, I'm very sure some of those things you were not even aware of before will be disclosed to you today. Likewise, if you have a question or you have a suggestion, please send us an email on askdocy@gmail.com. You can also keep in touch with us on social media. We're on Twitter, we're on Facebook, and we're on YouTube. And we'll be glad to hear from you. All right. So, how do some people describe fever? Most times when people come to the hospital, they say things like, I have malaria, I have typhoid, I have cough and catarrh, I have headache. Some people say things like they have feeling of heat coming from within. But only a few people will say things like, I have fever or I have an elevated body temperature. Now, this is the trick. Fever is different from malaria. Fever is different from typhoid. Fever is different from cough and catarrh. Fever is different from sore throat. The mistake most people make is, instead of them saying things like they have fever, they just assume it's malaria, which is wrong. Fever is a symptom, and I'm going to explain what fever it is to you. Fever is simply having a body temperature that is above the normal range. Now, take note of this. Fever can be defined as having a body temperature that is above the normal range. It simply means one thing, that there is a range for the normal body temperature. Once you go above that range, we can say you have fever. And once you go below that range, we say you have things like hypothermia. We're not going to talk about hypothermia today, but the basis of our discussion today is fever. Now, what is the normal body temperature range? The normal body temperature range is between 36.0 to 37.0 when taking it from under the armpits. Any temperature that falls outside this range needs to be monitored closely, and I'm going to explain this a little. If you come into if you're staying in an air-conditioned room, your body temperature is likely going to fall below 36.0. And some school of thought, or people will give, if you go to, several people have different school of thought, and they will give a range of temperature of saying probably from 35.8 to 37.2. So if the body temperature falls below 35.8, then you really need to monitor that temperature closely. Likewise, if your body temperature is getting above 37.2, you have to monitor those temperature closely. Now, don't forget, the normal range is what? 36.0 to 37.0, and anything outside this range needs to be monitored closely. Most times, when people want to check for fever, what they do is they just touch the body temperature. They touch and just say, okay, your body is hot. Or probably some people would say things like, he's having poor appetite, she's having poor appetite, or she's having stomach pain, or she's not sleeping well, or she's having headache, or she's having generalized body pain. Now, all these things can come with fever. But the fact that somebody supposedly has an elevated body temperature, which you detected by doing things like this, does not mean the person has fever. It could simply mean you are the one that is actually feeling cold, and you touch somebody who was hotter than you, and you assume the person's body is hot. So you just assumed, okay, this person has fever. And that is why you really need to understand how to detect fever. Now, so how do we check the normal body temperature? First of all, I'll let you know that body temperature can be checked through several routes. We can check your body temperature through the armpit, that's under the armpit. We can check it using what we call an infrared thermometer, which is what you can see here right now. There's a picture of an infrared thermometer. Also, you can check the temperature from the mouth. You can check the temperature from the rectum, that's from the rear side, the anus, to be straight. Then You can check it from the ear, and there are other places you can check temperature from, which I really don't want to go into right now. But the commonest route of checking body temperature is the armpit, and that is where you use this. The thermometer used in checking the temperature through the mouth or through the anus or through the ear is different from this type of thermometer. I wouldn't even advise you to even try using this kind of thermometer to check temperature outside the armpit. Now, if you do not have a thermometer in your house, you are wrong. Yeah, you are very wrong. Why? Because you need a thermometer to detect the body temperature. Even if the thermometer is feeling hot, it will not tell you that the person is actually feeling cold. But if you are feeling hot, okay, let me just give this illustration. I just come in from the rain, my hand is cold, and I shake you. What do you think will happen? You would tell me like, your hand is cold or your body is cold. Likewise, I will say things like your body is warm. But if you use a thermometer, I can assure you that you will get the accurate body temperature. And just for emphasis again, I would like to let you know that the body temperature can range between 35, when I mean body temperature can range, the normal body temperature, depending on the environmental condition, whether you are in the sun or you're in the air-conditioned room, or probably you just came in from the rain, can range between 35.8 to 37.2. But if you have a temperature outside this range, you will have to shine your eyes, take your thermometer and check the body temperature regularly. All right, so what are the causes of fever? Most people think of malaria whenever they have fever, and I totally agree with you. Why? Because we are in a malaria endemic area. Yes, we have mosquitoes around, and mosquitoes thrive well under our temperate region, this area. So most people who have fever most people who have fever because of malaria. And that's why most times people come to the hospital and say things like, I have malaria. Why? Because they just assumed, because I'm running temperature, I have malaria. But that is wrong. The commonest cause of fever here in Nigeria is malaria, but there are over 10,000 causes of fever. In short, you can have 1,000,000 causes of fever. But let me just give you some of the commonest causes of fever. Malaria is the commonest. Typhoid is also a common cause of fever. Infection in the urinary tract, which we call urinary tract infection, is also a cause of fever. Infection in the upper part of the throat, and I'm going to break that down. When you have cough or sore throat, it could also cause fever. Likewise, you could also have pharyngitis, which is an inflammation of the pharynx. It can cause fever. Dehydration, when you don't take adequate water and you're actually sweating or you're probably in a poorly ventilated area, can cause fever. Lower respiratory tract infection like pneumonia, bronchopneumonia, tuberculosis can cause fever. Boil or other bacterial infection on the skin. Some people have boil and it could be so painful. It can cause fever. Even pain can cause fever. Appendicitis, I'm very sure some people know what we're talking about. People who have had a surgery for appendicitis before will know that it can cause fever. Meningitis, what in Yoruba people will call yerun, can cause fever. Tetanus can cause fever. Measles can cause fever. Chickenpox can cause fever. Even some kind of cancers can cause fever. Ebola can cause fever. Even Lassa can cause fever. Now, all these things can cause fever. So if you come to the hospital and you say things like you have malaria and you are examined and sent for some further investigations and they found out that it is not malaria, we will have to treat the ideal cause. Okay, don't let me go into that details yet. We're still going to talk about that in the later part of this discussion. Let's talk about common symptoms of fever. The common symptoms of fever are elevated body temperature, which can be detected by using a thermometer. That is after you must have tried your own technique of touching the body and doing things like that. Yeah. Likewise, other symptoms of fever include shivering. The person may also complain of colds. Like say, I'm feeling cold. The person may be sweating. Then other things could be associated with fever, which include headache, muscle pain, poor appetite, child may be irritable, there may be dehydration, and the person may actually feel generally weak. In adults, you could have things like the person may be irrational, like the person may be saying things that may even make you feel like, is this person going crazy or this person insane? Person may even just be blabbing, like saying things that are not coordinated. Now, those are part of signs of elevated body temperature. In short, sounds more like a complication. Before we go into talking about what you do when you have fever, we're going to talk to you about how to check for fever. Once you have detected or you have checked for fever using your hand, the usual way of touching, or probably the person has not been eating well, or probably the person is having abdominal pain or that kind of stuff, fine, no problem, it's okay. The ideal thing to do next is to pick up your thermometer. Now, this is a digital thermometer. I already told you of other types of thermometers you could have, but this is a digital thermometer, and I think everybody should have this at home. Since, seriously speaking, you should have this at home. If you don't have this and you're a mother, please try to collect some money from daddy, or better still, if you don't have this at home, it is not ideal. Okay, so this is a digital thermometer. This is the point where you apply, or this is a point that has contact with the skin when checking for the temperature. Then this is the display point of the thermometer. This uses battery. There are other types of thermometer, which is a mercury kind of thermometer, but it is not so ideal because if it drops, it's going to break. Apart from the fact that it can break, it contains mercury inside, which could be poisonous if it's actually not if you're exposed to it, it can be poisonous. So this is ideal, and I believe everybody should have this. As long as you can afford buying a recharge card, you should be able to buy this because it is not so expensive. So instead of buying recharge card next time, just save the money and buy a thermometer for your family, and I'm very sure you'll really appreciate having it. So this is how we do it. There's a button here. Once you press it, it gives a beep sound. Yes, and that beep sound, after that, is going to display, well, this will display the last body temperature you took. Then after that display, it will it could show you something like LO, which means low, but it is not applicable to all thermometers. It's applicable to this one alone. So after you press this, now I just turned it off. After you press this, it comes on. You take this place and put it under the armpit. Now, you don't put it between the clothes and your armpit. I would advise, if you want to use this, make sure that you have something that will expose the armpit properly, or you're wearing a cloth that will expose the armpit properly, and you put it directly under the armpit and you leave it for a while. After a while, once it's through with checking the temperature, it's going to beep like this, and once it beeps, you can easily remove it from under the armpit. After you remove it from under the armpit, you can just check the temperature and you can easily read it. Don't forget, the temperature should be between 36.0 and 37.0. Anything outside this is not healthy. Let me remind you that fever is a symptom of an underlying disease. So after you've checked the temperature and you found out that the body temperature is high, you should know that there is something causing that fever, and you have to look for the cause of the fever. Now, the cause of the fever should be your priority while treating any fever-related condition. I usually explain this anytime I'm with my patients and talking to them about fever. I tell them things like, if you use paracetamol to treat any febrile illness, it is just the same as saying you are using air freshener to cover the smell of a dead rat in your bedroom. I'm going to explain it this way. If you have a dead rat in your room, the ideal thing to do is to remove the dead rat and throw it away. You would not take air freshener and spray the whole room. Yeah, the same thing applies to fever. If you have fever, something must be causing that fever. It may be chickenpox, it may be measles, it may be malaria, it may be typhoid, it may be, God forbid, Ebola. God forbid, it may be Lassa fever. But the ideal thing is look for the cause of the fever, treat the cause of the fever, Don't just give paracetamol or ibuprofen or any of all these NSAIDs and suppress the fever. Look for the cause of the fever. And so, after this break, I'm going to talk to you about how to manage fever at home. I have this explanation I tell people. If you want to manage fever at home, use etc. And what is etc.? ETC. What does it mean? Exposed to air, tepid sponge, and continuously monitor the temperature. Very simple, right? Yes, it is simple. Exposed to air, tepid sponge, and continuously monitor the temperature. Okay. Let me take you through this break. Once you have noticed an elevated body temperature with your hand, or probably after touching the head or touching the stomach, or you notice poor appetite in your child, yes, it is understandable when you say, okay, my child seems to have fever. But the ideal thing to do next is pick up your thermometer, put it under the armpit, just like we taught you how to use it, and check the body temperature. Now, if the body temperature is above 37.5 and less than 37.9. What am I trying to say? If the body temperature ranges from 37.5 to 37.9, if you notice that on a Monday morning, you don't need to force your child to go to school. Once you've noticed that elevated body temperature, your child doesn't necessarily need to go to school. What do? Expose your child to air. That is the first E. That is E. Exposed to air. When I mean exposed to air, what are we trying to say? Allow your child stay where there is air. You could put on the fan. You could remove the shirts. You can remove your child's shirts and just allow a breeze to blow on your child. If the body temperature is still getting high, what do? You get a clothes and get warm water. Not hot water. Warm water. And you tap with sponge. What do we mean by tepid sponging? You put the clothes in water and just use it to mop, not cold water and not water from your deep freezer. Warm water, lukewarm water, like almost body temperature. Then use it to mop the child's body. That is what we call tepid sponging. After doing that, you still continuously monitor the body temperature every 30 minutes at least. Why? If you monitor the body temperature and you notice the body temperature is still increasing, then you should know this is getting serious. At that point in time, you have to take, if you have paracetamol at home, you could give your child paracetamol. Now, if you're going to give your child paracetamol, you have to know the ideal dose you should give your child. Paracetamol, I've seen a lot of people come to hospital and say things like, my child was running temperature and I gave paracetamol. And you ask how many tablets of paracetamol and they tell you things like 2 tablets. That is overdosing. And I can tell you that there are several children that have had their kidneys and their livers destroyed because of paracetamol use. So, I'm going to talk to you on how to administer paracetamol. First of all, you have to know your child's weight before you can administer paracetamol appropriately. So, you must have a scale at home. I believe every parent should have a weighing scale at home, if not for giving drugs. At least you should be able to monitor your weight and your child's weight to know if your child is growing properly. First of all, like I said, you have to know your child's weight. Secondly, you need to calculate the dose of paracetamol you're going to give to your child. So how do you calculate the dose of paracetamol to give to your child? It's very simple. Paracetamol's dose is 10 to 15 milligrams per kg per dose. Your pen and your paper, right? Yes. 10 to 15 milligrams per kg per dose. It simply means if your child is weighing, let's say, let's take it simple first. If your child is weighing, let's say, 10 kg, it means the minimum dose of paracetamol your child can take at once is 100 milligrams. And the maximum dose your child can take is 150 milligrams. So you now have a range. It ranges between 100 and 150 milligrams for a 10 kg child. If your child weighs 20 kg, the dose for paracetamol, minimum dose of paracetamol for a 20 kg child is 200 milligrams. And the maximum dose for a 20 kg child is 300 milligrams per dose. Now, let's bring it down. If you've seen paracetamol before, the right behind it, P500. That means that is 500 milligrams. If your child is weighing 20 kg, you can break one into two and give your child half. That is 250 milligrams. Remember, it falls within the range of 200 and 300 milligrams. That is the dose your child should take. Falls between 200 and 300. So giving your child half paracetamol is okay. But if your child weighs 10 kg, you cannot give your child half paracetamol. That will be overdose. A lot of patients have been doing things, a lot of patients have been doing that, a lot of mothers have been doing that, a lot of fathers have been doing that, a lot of grandmas and grandpas have been doing that, which is wrong. A lot of aunties too have been doing that in schools, which is wrong. A lot of children come to the hospital with kidney and liver failure because of paracetamol overdose, and this is how it starts. So, a child weighing 10 kg cannot use tablet paracetamol. That child is supposed to take between 100 to 150 milligrams of paracetamol. And if you're breaking one into two, if you're breaking one paracetamol into two, you're getting 250. If you're supposed to break 250 into two, you'll be getting 125, which might be very difficult to get. So instead of giving your child tablet paracetamol, it's better you can go for the syrup paracetamol, which you could easily get as 125 milligrams per 5 meals, or depending on the companies and constitution or how they've made it. So don't forget, this is how to calculate dose of paracetamol before you give it to your child. Overdose is not ideal. So we're going to talk about what to do once you notice an elevated body temperature in an adult at home. Now, after you've done your usual technique of touching the head, touching the stomach, and yes, the body temperature is hot, ideally you should take your thermometer and check for your body temperature to find out if really you are running temperature. Adults usually find their way around it when they are feeling hot. For instance, if I'm feeling hot, I can easily just pull off my shirts and stay in front of the fan and cool off. But a little child will not likely tell you things like, mommy, I'm feeling hot, I want to. So that's the reason why management of fever in adults and children differ. Also, an adult can easily take and monitor his temperature regularly, but you just notice the child just gets gentle. So those are the differences between it. So let's talk about the adults. You can still apply the ETC in adults. Exposed to air, you really don't need to tepesponge an adult. An adult will just go to the bedroom to take his bath. So that's the T part of it. And the adult can also check his temperature regularly. So you can check his temperature. That's the C part of it. So that's the ETC. Now, if this temperature keeps increasing above 37.9 after you've done all these things, I would advise you visit the hospital for investigations. Yes, it's very easy to go to some pharmacies and get anti-malarials and antibiotics. I call that guest treatment. In fact, sometimes some people come to the hospital and tell us things like they bought Ashakpo. And when you ask what is Ashakpo, they will tell you they give them all sorts of drugs. Okay, it is not ideal. That is guest treatment. Instead of doing that, go to the hospital and let your healthcare practitioner or provider do some investigations for you, examine you, and I'm very sure you would get the best treatment and you would spend less. If you have been taking any drug on your own and you notice your temperature is not getting better after 48 hours of using the drug, I would advise you to go to the hospital, because what you thought is malaria may not be malaria. It may be typhoid, it may be, God forbid, Ebola, God forbid, Lassa, and we don't pray for that. So next thing we're going to talk about is complications of fever. Convulsion is the commonest complication of fever you see in children. most times you see people come to children emergency and you see them jerking, and you might probably have seen spoon in the mouth. Okay, yeah, all those things are really not necessary. But those are the convulsion is the commonest complication you see in children who have high-grade fever. Confusion, or what we call irrational talk. Sometimes you see an adult come to the hospital saying irrational things, blabbing, like they really don't even know what they are saying. They just keep saying things like, they are not rational. It could be a complication of fever. A person with high-grade fever can also be having elevated breathing. The person may be breathing very fast. There may be elevated heart rate, and prolonged fever can cause destruction of red blood cells. And once the red blood cells are destroyed, the person becomes anemic. The person gets short of blood. And when the person is short of blood, the person can die. In summary, I'd like to remind you that fever is a symptom of a disease, not a disease itself. Every family member or every family should have a functional thermometer, and you must know how to use it. Like we told you, you put it under the armpit, and the normal body temperature can range between 35.8 degrees Celsius to 37.2 degrees Celsius. And any temperature outside this range, probably lower than this or higher than this, needs to be monitored closely. Treat the cause of fever, not just suppressing the symptoms of fever. And if fever persists after 48 hours of you applying any drug, taking any drug or using anything, ensure you visit the hospital for proper treatment and follow-up. Thank you for being part of today's series of Dr. Y. We hope you've had a very nice time. I'm very sure you learned a lot. We'll be taking another topic and your questions next week, and I'm very sure you can afford to miss it. Your questions and comments, suggestions will be welcome on our social media. We're on Twitter, we're on Facebook, we're on Instagram, and we'll appreciate if you like our Facebook page, and we'll be glad to hear from you. Thank you very much. See you next week.
Call on doctor's attention if you need solution.